Okay, welcome to the talk. This one is all about myth busting. So there's lots of myths about dentistry that we just want to really clarify, make sure the record is set straight. Okay, so number one, we have when your gums are bleeding, you should brush them less or not so vigorously near the gums. You should avoid that area. Now, this is a common one. We get this all the time. So patients say, well, I've been avoiding that area. I've been avoiding flossing because it makes them bleed. Well, guess what? You've just made it worse, because the reason why they're bleeding in the first place is because of plaque building up around the teeth themselves. And the plaque is because you've not been cleaning near the gum enough. That doesn't mean that you should brush hard. I don't want you to get the toughest bristle brushes and really go at it, because that can do more damage. But essentially, if you start flossing for a couple of weeks, you will see the bleeding slowly reduce down over that time. If you start brushing into the gum area softly but gently, you will see the bleeding reduce down. Furthermore, if you go and see your dentist for a clean, because that's probably what's needed, and a check for gum disease as well, you'll find that after they've done the clean and after you've started a really good oral hygiene regime, you should find the bleeding reduced down. So when they bleed more, you need to clean more, not less. That's number one. Okay, so number two, we have hidden sugars. So a lot of patients come to us and they say, I don't have any sugar at all yet. I've got holes here, here and here, and I need a root canal. So what is going on there? Essentially, a lot of people are not aware of hidden sugars. There's hidden sugars in all sorts of things. You can have somebody with a really healthy diet and it's high in sugar. So for example, if I was to eat fruit all day, it's a real healthy diet, but fruits have fructose, that's a fruit sugar essentially, and that will rot your teeth just like any other sugar, just like glucose would. So a lot of people they misconceive it as to sugar is only cane sugar, the stuff that you put in your tea, or a cake might have sugar icing on it or inside it, but it's not the case. There's lots of hidden sugar. So if you have, let's say, a fruit yogurt, you might be following a healthy diet, you have a fruit yogurt, that fruit yogurt usually has sugar in it. Fruit has sugar in it, fruit juices have sugar in it. Even natural sort of food, every time you eat any meal, whether it's low sugar or not, will give you a sugar spike. Because those sugars, they're broken down inside your mouth and the bacteria feed on them. When the bacteria feed on them, they rot the teeth essentially. So first of all, it's about educating you in terms of knowing that there are sugars that are hidden away. The second is to know that it's actually the frequency of the sugars that's important. What do I mean by that? I mean that if you had a bunch of grapes and you had them all within a minute, it probably wouldn't damage your teeth that much. But if you had a bunch of grapes and they were sat on your desk at work and you're having one of those every half an hour, that's going to completely rot your teeth. One is completely different to the other because those bacteria are being fed every half an hour, i.e. they're having a buffet every half an hour, whereas in the other example where they're being fed just at meal times, then the bacteria are starved in between meals. They've got no sugar to eat, they're starved, and the teeth are left undamaged. Okay, so number three, we have pregnancy, basically. Pregnancy and its effects on your teeth and your gums. Mums come to us with rotten teeth, or they've had fillings done in the past, and they sort of blame the baby for sucking all the calcium out of their bloodstream and out of their teeth. But that's just not the case. Once your teeth are formed, your teeth develop as babies, they develop inside the womb, so that's your baby teeth. If they're adult teeth, they develop, you're very young at the time, so you might be anywhere between the ages of 3, 6 and above, and they're developing at that stage. Once they're fully developed though, they are done, that's it, the calcium's done. You can get the rare occasion where the tooth hasn't formed properly and the enamel is deficient, but most people don't fall into that category. Most people have rot because of sugar levels after. Although saying that, it can affect your gums. Your gums can bleed more, that's hormonal. It's a really important time to go and see the dentist, have your gums checked, have some cleaning done, improve your flossing and your little interdental brushes, improve your hygiene to keep the gums healthy. You'll find that they still bleed quite a bit, but after the pregnancy is over, the hormone levels settle and you'll find that the gum settle too. There is another rare condition as well which happens around the gum, and it's where you get a gum swelling in one particular area. So it might be a swelling about that big, and essentially that is called a pregnancy epulis. that's just a swelling, and it usually is down to hormones, but also a little bit of irritation. It's important to have that area cleaned out. They often resolve after pregnancy, but sometimes they don't, and there's still a bit of swelling on the gum, and they sometimes need a little bit of minor surgery to remove them.